What I want to start with is the type of person who maybe you weren't really like us and you are having a little bit more health problems. This is where traditional insurance can be helpful. If you are chronically ill, maybe you have cancer or you have IBD like Crohn's and ulcerative colitis.
And medications that are really expensive.
Right, you're on biologics, you're on insulin, you need health insurance. Let's start there. What you can also realize is you can do what's called a HSA or FSA plan. There are ways that anything you are spending out of pocket, including any out of pocket specialists or supplements, you can get a tax write-off.
And that stands for health savings account or flex spending account. So we had that. When I was at my last employer, I was the one who provided our family with health insurance. And I learned about HSA and FSA. And I was like, oh, cool. Okay. So that is money that is pre-taxed and going into this savings account every month. And we're deciding how much gets taken out of my paycheck to be put into this health savings account or flex spending account. And you can only use those funds for healthcare related services and healthcare related expenses. So you can buy glasses with them, go to a chiropractor, pay for your supplements, or do something related to healthcare, pay your copays with it. So if you recognize I'm spending whatever, $100, $500 a month, if you have the option, you can elect for an HSA or an FSA.
That is huge. That's a whole nother episode of taxes. So understanding your taxes is huge, and the tax saving really just adds up every single month. So to not pay taxes on certain aspects that you're spending on every single month is huge. So that is huge. Now, if you fall into another category where maybe you were like me, where like I never use my my doctor's visits. I never really go into. I don't recommend you never get labs done. I don't recommend that. But if you're like, I don't see a doctor, I don't have a specialist,
you should.
I mean,
or
you should have
see
it.
someone.
I'm not saying I had a doctor, but I never went in. I was like, I feel great, so I'm not going to go in. If that is more you, if you fall into that category, then there's health shares, right? So there's health shares which can replace your current health insurance. There's one called Christian Healthcare Ministries. Typically these health shares are faith-based and religion-based. They're part of a section of this that is a faith-based. I guess you can call it a loophole in a way, but what it is essentially you're putting in money to then cover everyone's costs if you were to fall ill, if you were to get into a car accident and break your arm or need life-saving surgery. And there's different tiers of this. Again, there's lots of details to go into, but it's really saying, wow, there's other options out there. That is what we went through. We found that even with paying for what Dahlia needs out of pocket was far less than what we were paying every single month through our employer, plus through our own pocket out of our paycheck. I mean, what we pay out of pocket for Dahlia's care is a fraction. And on top of that, we see a chiropractor. We
all have our practitioners. We do blood work out of pocket. I pay for my medication out of pocket, and it's cheaper than what I used to pay with insurance. So what a lot of people don't realize is by law, insurance has to charge you a copay. And that's a predetermined amount. So they can have a $20 copay for any medication you have. Even if that medication out of pocket would have costed $5, the pharmacy is not allowed to charge you the true cost. They have to charge you your copay. So I was paying more for my medication with insurance than I now pay out of pocket for my medication. And I pay less now that I don't have these high insurance premiums every month. I pay less for getting my blood work done, seeing my specialists who support me with my health than what I was paying before, to just pay my copays and deductibles and pay for that monthly traditional healthcare insurance. And then, James still, we ordered James's labs, make sure all is well. If there were anything that were to pop up, we do have our go-to, specialist and our primary doctor who he can see if anything were awry. We know we're in a unique position because we're both healthcare practitioners. We don't recommend this. If you're not a healthcare practitioner or have one who can support you, please do have a primary provider that you can see. Please have your labs ordered every year. But there are ways that it can be more affordable.